Hello everyone, my name is Feng Xi, a senior at Gustavus Adolphus College, double majoring in computer science and psychology honors. In this presentation, I will give a general overview of the subject, psycho-oncology. The field of psycho-oncology is concerned with the psychological, social, behavioral, and ethical aspects of cancer and its treatment. Cancer itself is not a single stressful event, but rather a series of challenges that evolves and changes over the course of diagnosis and treatment. These challenges vary depending on characteristics of the person, the specific disease, and the environment in which they find themselves. Adjustment to cancer is multifaceted, as it involves the preservation of life flows, regulation of emotional distress, and remaining actively involved in aspects of life that continue to hold meaning and importance. Hence, the burden of cancer extends beyond the physical. Heightened psychological distress is commonly observed after a cancer diagnosis. Depression is among the most common difficulties experienced as a result of cancer and its treatment. There is also mounting evidence that psychosocial factors are relevant to cancer growth and the spread of cancer from the original site to other parts of the body. Problems appear to be greatest among people who cope through avoiding the cancer experience and make little use of active, approach-oriented coping strategies, as well as those who have chronic stress, a diagnosis of post-traumatic stress disorder, or a lack of social support. Hence, an understanding of coping and adjustment to cancer is crucial. In the past, psychological theories emphasized the central role of a person's cognitive appraisals, which refers to the personal interpretation of a situation that influences the extent to which the situation is perceived as stressful. Particularly, much attention has been paid to the role of cognitive appraisals in mediating emotional well-being and in the search for meaning in an effort to adapt to adverse events. More recently, the theoretical constructs of mindfulness and acceptance have received a great deal of attention. The three interwoven aspects of mindfulness practice include present moment awareness of internal and external experiences, the conscious choice of the person, and openness and non-judgment. Current interventions include cognitive behavioral therapy, family therapy, support groups, and internet interventions. Cognitive behavioral therapy focuses on reducing depression, managing stress, controlling fear of recurrence, and developing good coping skills. Family therapy is helpful since emotional support from family or having strong partner relationship is beneficial, especially since disturbances in relationships after a diagnosis of cancer are fairly common. Support groups can be particularly helpful for people who lack family or community support, and internet interventions are increasingly seen as a way to improve access to high-quality care across geographical and socio-economic barriers. Thank you for your time. If you have any questions or want to know more about psycho-oncology, please consider joining the 2020 Nobel Conference, hosted virtually by Gustavus Adolphus College, on October 6th and 7th. At the conference, we invited three professionals, Suzanne Chambers, Shanita Hughes Halbert, and Catherine Schmitz, to present on the topic of psycho-oncology.